Hi, my name is Shalini Praveen. I'm going to be performing spontaneous vaginal delivery for my female patient. As you can see, she has already gone through stage 1 of delivery, that is cervical dilatation and fetal crowning. The head is visible for almost 3 to 4 centimeters. There is a procedure performed called episiotomy. It is performed when a normal fetal head is not observed, rather the fetal head is bigger, or when you have very slow spontaneous delivery. Now, before performing this procedure, always incise your fingers in between and give anesthesia lower to the vagina intramuscularly. There are two types of incisions. One is midline, that is the incision is towards the rectum. The other is lateral, a little lateral towards the from the rectum, called mediolateral incision. And after delivery, this incision is usually staged up. The mediolateral incision is preferred, but its healing process is comparatively slower. After episiotomy, we go to Röntgen's maneuver. Take a sterile towel, place your hand at the lower part of fetus occiput, gently move the head outwards, then rotate the baby towards the side after the baby is seen. Now help the baby with a downward traction so that the anterior shoulder is seen. Then push the baby with upward traction. When both the shoulders are seen, use your dominant hand to support the lower part of the body, while the other hand to support the fetal head, and push the baby outside to deliver. Okay, after delivery you have to use a sterile towel to pat and dry the baby. As you are patting, note for baby's breathing and muscle tone. After this, place the baby on the mother's abdomen. Either you can place the baby in between the mother's breasts or on the abdomen of the mother, so that you can initiate skin to skin contact. Take a new set of covering for the baby, and after a few hours, ask the patient to give exclusive breastfeeding 2 hours after delivery, and for at least 6 hours do not let the fetus have any kind of shower, to protect the baby from any kind of infection. Now, cord clamping. Usually a 2 to 5 cc's of clamp is used. The first clamp is placed 2 centimeters from the umbilical cord. The second clamp is placed nearly 5 centimeters from the umbilical cord and is cut in between. Okay, and is cut in between. The baby starts the suckling reflex after 1 hour of delivery. As you can see, after delivery, the gush of blood is noted, and for at least 5 to 30 minutes you can note lengthening of the umbilical cord. Okay, and the uterus shows a Calkin sign. A Calkin sign is when the uterus, with the length of the umbilical cord coming up, the maternal abdomen from a discoid shape becomes into an ovoid shape, that is, the placenta is completely erupted. You may push the placenta by pressing on the maternal abdomen. So this is the placenta that is delivered. In the placenta, note for the placenta for 3 things: 3 vessels, that is 2 arteries, 1 vein, cotyledons, and for infarcts. Okay, now inspect for the vagina for any kind of lacerations. Okay, if you have performed an episiotomy, whether the midline or the mediolateral, check with the reference of the rectum if the incision is precise, and if you need if you have to give stitchings, give the stitchings. And in the end, check for the uterus, inspect the uterus if it has completely contracted or not, so that all of the placenta is already delivered. Thank you.